Okay, I think it's a good time to get started. I'm going to begin just by welcoming you today to our session, Uncovering Unconscious Bias in the Equity Challenges track. Before I introduce you to our presenter, please bear with me as I share a few logistical notes. This session is being recorded and the chat is being archived. Attendees are in view-only mode to keep things orderly, so you cannot use your microphone. We encourage you to use the chat box instead to engage with the group. You can post here for any technical issues you experience, as well as any questions you would like to share with presenters. We will share these questions towards the end of the hour. This session uses auto captioning. While these captions will not be exact, we hope they can improve accessibility for all attendees. To activate these as a viewer, please look for an option on your toolbar that says live transcript and select either subtitles or full transcript, which will appear in a sidebar. Your options may differ on a mobile device. If you are intending to claim professional development credit through SC Endeavors for early educators, please complete the submission form we will share in the chat box shortly. This link will also be provided once more at the end of the session. It is essential to having the information needed to process your credits. Please remember that you must attend the session for its full 1 hour duration to receive credit. All right, with all of that being said, we can begin. And I am pleased to introduce our presenter for this session, Mary Garvey, Director of Inclusion and Innovation with the Institute for Child Success. Mary?
Thank you, Amber. Thank you all for joining us here today, and I will just go ahead and get started. I want to start off with a bit of a trigger warning here because we will have some discussions around trauma, childhood trauma, and it could be a topic that's triggering for some of us, and I wanted to make sure that I gave you all a bit of a heads up around that. Next slide, please. Okay, so today's agenda includes the following. We will first discuss the manifestation of unconscious bias, which will, of course, include defining what exactly unconscious bias is. We will then delve into how bias impacts our children, and that's probably the area for which the trigger warning is most necessary. And then finally, we'll talk a bit about what we can do. And so if you have attended similar sessions before, you'll see here on our next slide that there are a few things that will be different or updated or new about this session. So we will be able to hear directly from parents and guardians of young children who have experienced implicit bias. And so we'll hear what they have to say. We will have a discussion of adverse childhood experiences, or ACEs, as it may or may not relate to implicit bias. And we'll talk a bit about young children's biases by talking about the results of a relatively recent study that was done about whether or not young children show their own implicit biases and how young we may see that begin to manifest. And so, just keep in mind, as the slide says here, we are constantly updating our unconscious bias research work and trainings. So defining unconscious bias, for the purposes of this presentation, unconscious bias and implicit bias, we're treating them as one and the same. So if I switch between phrases, just know that I am still talking about the same thing. And if you look at the definitions below, we've provided two, you'll see why it may be the case that people sometimes call it implicit bias and other times it is referred to as unconscious bias. And so the thing to note in the Yale School of Medicine definition is the word unconscious. We also have biases that are just more explicit, that are really obvious. Some of you that have children, if someone said to you, hey, do you favor this child or someone else's, do you favor your child or someone else's child? You'd probably say my child because it's your child, right? So that's, a bias, and that's an obvious bias and probably an expected one. But then there are those biases that we probably we're just less informed about. And so the second definition here, which comes from a document called Implicit Bias, a Primer for Courts, which was written by Professor Jerry Kang out of California, stresses the importance of stereotypes and also attitudes when we are discussing implicit bias. The thing to note about this is that when we start thinking about how stereotypes and attitudes form implicit biases, then we really need to think about what the impact might be then of these biases on behavior. And then, of course, if we're talking about behavior, we're also talking about decision making, and therefore, and thus how implicit bias may impact others who are around us. So about the word implicit, the word implicit really speaks to not being aware, as I said before, or you might be aware, but you're mistaken about where this bias comes from. And if you're mistaken about it, you probably don't even think about it as a bias. So those are the two things to note about the definition. And so when I think about hearing that, maybe unaware of where a bias has come from. There may be cases where we all have our biases, first of all, and there may be cases where there's a bias that we have and we think that it's steeped in reality, right? This thing is fact, but in fact, it's not. It's not the case that it's fact. It's our perception that has been formed from something that we don't even realize has impacted the way that we view the world and society and individuals. So implicit bias is known to predict things such as rate of callback interviews, how we read friendliness of facial expressions. I will tell you, as a born and raised New Yorker who lives in New York City currently, but I've, as someone who's lived somewhere else, a little bit further south, I will tell you that my facial expressions have been misread a lot. And I've had to tell people, no, I'm not upset. This is my face. This is what many of our faces just look like on a regular basis, on a day-to-day in New York. So it doesn't mean that, we're unfriendly necessarily. So implicit bias is also known to predict more negative professional evaluations, and also the amount of shooter bias, which refers to how likely a law enforcement officer may be to shoot a suspect based on the suspect's race. And so the idea behind this slide, the takeaway here is that implicit bias has real life, real world consequences and impacts. Next slide, please. And so when we think about callback rates, for example, and I just basically pulled one example off of that list to go into a bit deeper. So we're talking about whether or not someone gets called back after an interview, especially if it's a qualified candidate who has interviewed. We see that there are some disparities there. And this is a relatively this is an older study, but it's something that is still present and a discussion today. I'm pretty sure that I just saw something in the news about applicants' names just this week. And so the things to note here is that for this particular study that was published in 2003, Black applicants without criminal records fared worse than their white peers who had a criminal record. So if you were a white man who had applied for if you're a white man applying for a job and you had a criminal record, you had a better chance of being called back for an interview than a Black man who also applied for that job who did not have a criminal record. And so for some of us, it may be a bit of a jarring study. For others of us, we kind of are like, oh, okay, well, we knew that, or it makes sense. And so if this is a topic that interests you, just how implicit bias and discrimination affects job searches, you may also want to look up the case of a man who switched his name from Jose to Joe. So basically removed a letter and got no callbacks as Jose, but then got multiple callbacks after removing one letter. So, again, looking at something like searching for employment is a very vulnerable state. And then to think that there's this additional concern, you have to think about how your name may appear to an interviewer is certainly an added level of stress. So how does this relate to our worlds of early childhood? So when we look at these particular examples, we probably will start to say, well, if it's this pervasive, implicit bias is this pervasive within society, maybe we shouldn't be surprised that it would make its way into our classrooms or into the lives of the youngest members of society. And so we know that implicit bias is inherent in preschool suspension. So we're not going to get too deep into this topic, but we'd really be remiss to not at least touch on it a bit with the discussion of implicit bias. And so studies have shown us that the greatest predictors of whether or not a child will be suspended from preschool, so a 3-year-old, 4-year-old, is being big, Black, and boy. And so if a student has all three of those descriptors, then his rate of being kicked out of school at such a young age drastically increases. And so this particular study was based off of public preschools. And so based on maybe like 1 or 2 studies that have been done in private schools, and private schools are not required to report out, or at the time of the study, they were not required to report out on suspensions and expulsions. But based on one study that we did see, we know that the rates were twice as high on average, which one particular study showed us that around 50,000 preschoolers had been suspended at least once. And so we know that Black children on a whole are 2.2 times more likely to be suspended or expelled than their peers. Boys, so when we look at it from the lens of gender, boys are 51% of the preschool population, but 82% of the suspensions and expulsions. And so here we see another manifestation of implicit bias, and it's referred to as adultification, which is defined to the top right in the call out box. And so when we look at why this may be an issue, seeing Black girls as older than they are, especially between the ages of 5 and 14, you look at this image and you see that when a child is viewed as being less innocent than they are, they're also viewed as needing less protection, less nurturing, less support. And we're all here, and most of us in the early childhood field, we know that those are the very things that children need in order to develop properly, in order to just feel loved and valued and protected within childhood. So of course, that perspective leads to more exclusionary discipline outcomes, such as being removed from the classroom or out of the school building. A few other stats that I'll share with you before we get to our poll question are that minor violations such as cell phone usage and dress code violations, Black girls are also 2 times more likely to be disciplined, and 3 times more likely when it comes to disruptive behavior. And okay, so we have our poll here. So I mentioned earlier that one of the things that this presentation and discussion would cover is the manifestation of implicit bias in preschoolers, in young children. And so before we talk about the study that will be shared here today, we would like to poll you all and get your thoughts on the following. Do you think a preschooler's own race, so a small child, a 3, 4, or 5-year-old, predicts that child's implicit bias? So we'll give you some time to get your votes in. Okay, so 57% of you said yes, you do think that a preschooler's race predicts their implicit bias. 10% of you, sorry, it's 23%, so 10 of you said no, that it does not predict the bias, and 20% of you said that you are unsure. Okay, so because this is an opinion question, there isn't a right or wrong answer, but we will tell you that what we found in the study. There is an answer based on the study, whether or not it does. So in the study that is summarized here, the main thing to note is that the majority of children in the study, both Black and white, had a strong and consistent pro-white bias. And so this particular study was a race and gender study of 4 and 5-year-olds. what we see here is that white boys and girls were viewed most favorably by the majority of preschoolers, and Black boys were viewed least favorably by the majority of preschoolers. And so, again, if we were to have an overwhelming point here, it would be that children do begin to mirror society's biases, potentially as young as ages 4 and 5. And that's all children. Okay, we can move along. All right, so getting into how bias impacts our children, and just mentioning again that there will be some discussion here of trauma. So implicit bias often results in the following: racial trauma, other trauma, educational disparities, and of course, also preschool to prison pipeline. Here you'll see a list of adverse childhood experiences, which are generally broken down into these three categories of abuse, neglect, and household dysfunction. And so we don't have a poll question for this one, but I am curious, since we are discussing implicit bias, what the group thinks, and you can just write your answer in the chat, and the panelists will see it. Is implicit bias or racial discrimination an adverse childhood experience, or should it be an adverse childhood experience? Why or why not? If anyone has any thoughts on that they'd like to share in the chat. And so as folks are thinking about their responses to that, adverse childhood experiences basically identify what are referred to as PTEs, or potentially traumatic events that occur during childhood. Okay, one person has responded, yes, it can affect the child's life and outcomes. Another said, I know it is not yet considered an ACE, but I absolutely believe that it is an ACE. It is an ongoing stressor. We have another participant that has said yes. Another says, yes, it could affect their sense of self-worth moving forward in life. Another, yes, racial discrimination affects future. Yes, implicit bias should be in ACEs because it affects the child's sense of self. Another response, absolutely. Okay, thank you. Thank you for being active participants here. Okay, so at greatest risk when we talk about ACEs, research has shown us that Black and Latinx communities are at a greater risk of adverse childhood experiences, as are women and girls, and also lower socioeconomic groups. And so at essentially saying, if you're a member of one of these groups, then there is an increased likelihood that you'll have more ACEs, in particular 4 or more ACEs. And so I want to point out that this means that there is a level of stress and potential trauma in how society views or interacts with these identities. So in other words, being born as a Black person, or a person in the Latinx community, or being born as a woman or of a lower socioeconomic group should not be viewed in and of itself as a problem, but rather how society interacts with those identifiers and what it means on a day-to-day. And so if we could go back to the ACEs slide really quickly, one more thing that I'd like to note about it, about the slide before this one, is that, with many of the things that have gone on in society recently, from the protests across 50 states last year to the insurrection at the Capitol, and wondering, well, what if these, what if these domestic terrorists look different? Would there have been a different response? And just a host of other things. It would be an interesting conversation to have about whether or not some of these things, these adverse childhood experiences, are actually experienced at a community level. And so, for example, abuse. So a child may not necessarily be abused at home, but what is the impact? What is the stressor on a young child to constantly witness violent deaths of people who look like them at the hands of law enforcement or otherwise? what is it like to be in a classroom and feel that you are neglected? Should those things also be considered, whether or not the child is experiencing them or witnessing them at a community level. They might be in an environment where this is something that is happening, or in a society where this is something that is happening frequently. Okay, next slide, please. It's just something for all of us to think about. And we can move along to the next one. So childhood trauma and lifelong health. There is a movement that is gaining a bit of speed, where the idea is that you cannot be trauma informed without also being culturally informed. And so this ACE pyramid kind of reflects this. And so this is from the Center for Disease Control and Prevention, of course. And so the idea behind this movement of being that you have to be culturally informed if you say that you're trauma informed is really acknowledging the impacts of implicit bias, structural racism, things of that nature, and the general experience of people of color and marginalized individuals in society, especially when there has been this history, generational or otherwise, of marginalization. So just incorporating that and thinking about what that means for quality of life moving forward. And so when we take another look, ACEs through an equity lens and kind of thinking about what these different layers, what we think about the addition of these different layers, this particular model highlights, and so it's set alongside what was the original ACEs pyramid on the left. And so it highlights the role of things like microaggressions and implicit bias, and something that we call epigenetics, which is how behaviors and environments impact gene expression. You'll see a term here as well. I just want to make sure that this isn't necessarily a confusing diagram. I'm not going to get into it too much, but there is a term here that says allostatic load. And so that is how chronic and repeated stress impacts the body. So of course, more things to think about when we think about like what it means to begin or continue viewing adverse childhood experience with a more equitable lens. And so I'll pause a bit and see if there are any comments or thoughts on the comparison of these models in the chat. Please feel free to share any thoughts that you may have, or even things that you may want to see that are not here. Okay, we'll move on. So when thinking about implicit bias and childhood trauma, what the additional layers on the ACEs pyramid really mean for us practically is that we need to consider things such as social conditions, because social conditions and environments can lead to an increased likelihood of implicit bias, which then leads to potentially traumatic events happening or adverse childhood experiences, because we know that that's what those are. So here you'll see that racial trauma, if not considered an ACE, and we had a discussion about that just a few minutes ago, should at the very least receive the same level of concern and resources due to the documented impact. And so there is this particular study that is called Making the Case for Culturally Informed. It's cut off at the bottom, but it's sourced here. And actually some of the researchers on there are out of the Medical University of South Carolina. So the idea here is that they said, research shows us that racial trauma leads to increased anxiety, depression, thoughts of suicide, or being more prone to suicide. Thank you, Amber, for placing that resource in the chat. And also having lower self-esteem, which several people commented on earlier. Okay, so we are going to begin talking just briefly about school to prison pipeline. And so we have this poll question here before we get started in that conversation. And so by the age of 18, what percentage of Black boys would you say have been arrested at least once? All right, so according to the results, 13% of you said 10% of Black boys by the age of 18 have been arrested at least once. 31% of you said 20% of Black boys by age 18. 40% of you, which is the majority, said that 30% of Black boys have been arrested at least once by age 18. And then 17% of you said that 40% of Black boys have been arrested at least once by the age of 18. Okay, so if we go to our next slide, we'll see what the actual statistic is. So at the bottom of the slide, you'll see that by the age of 18, according to this particular study, 30% of Black boys have been arrested. And it is staggering. I mean, it literally took my breath away the first time that I saw this, that by age 23, that number is very close to 50%. And so when we talk about school to prison pipeline, it comes with the knowledge that when a child is out of the classroom, it increases the likelihood that they will have involvement in the juvenile justice system. We also know that along with exclusionary discipline comes a level of exposure, sometimes to law enforcement, that wouldn't have necessarily happened if there wasn't that exclusionary discipline. There was a point in time where I felt like someone said, "This is astounding." Just curious if you have the same statistics for white boys in comparison. So I believe that the study that's cited here does have that statistic. It's just not here on the slide, but it is a smaller statistic. I want to say that it might be 22%, but please don't quote me on that. It's in the study. And yes, it's very astounding. And as I said, just took my breath away, by that. Half of Black boys would have been arrested at least once by the age of 23. And so, when a child is taken out of the classroom, there is a likelihood that they'll end up with some kind of interaction with the juvenile justice system. And it's important to note too here that many of us follow news stories, and it can be really overwhelming and depressing sometimes. But I remember a time when I felt like I was constantly hearing stories about school resource officers and seeing very disturbing videos of children being beat up by these officers who were told to patrol the school grounds, actual police officers within the school, who didn't necessarily have the level of training to be working inside of a school. And more likely than not, it was a child of color when I saw these stories. Not all of the stories, but the majority of the ones that I've seen. That is definitely something that I noticed. And so, again, this is something that we have talked about a little bit more. We won't have the time to get into it too in depth for this particular presentation. But again, because we are talking about implicit bias and how it impacts young children and their futures, I wanted to make sure that we did touch on it a bit. And on our next slide, we'll see something that I think is actually, okay, so it's on the slide after this one. I want to make a really important point about what we just saw. So bringing back the slide that shows us that the predictors of preschool suspension are big, Black, and boy, something that we think about, something that we can think about here are what the statistics look like. We can go forward to the repeated big Black boy slide, and we'll see some statistics there that'll shed a bit of light on the topic. And right here, thank you. I think I was confusing just now with my instructions. Okay, so Black students make up 18% of preschool students, but about 50% of those suspended. So I wanted to make sure that statistic was out there. And if we go to the next slide, what we'll see, language and perspective and the lens that we use are all things that are really important when we discuss these topics, because it's probably really easy for some of us, not necessarily everyone, but it's probably easy for some to look and see a statistic like that and say, well, Black boys are just more aggressive or, meaner or more violent, and that would be what I've labeled here as the normal lens that we could view this through, that there is a disproportionately high rate of preschool suspension for Black boys because they're just overly aggressive and inherently greater threats to their peers at ages 3 and 4. Or we can say, there's a disproportionately high rate of preschool suspension of Black boys because sometimes preschool teachers perceive Black boys as being inherently dangerous and threatening even before interacting with them. And we know that this happens because implicit association tests have showed us that this may be the case. And this leads to harsher, more exclusionary punishments with little thought given to restorative practices and what it might take to keep a child in the classroom and within their learning environments. And the fact that there are also probably other disciplinary measures that do not involve putting a child out of their learning environment. So last year, around between May and July, so in 2020, it seems like so long ago at this point, we thought as an organization, who better to hear from at the height of the media's focus on racial tensions and protests in all 50 states, again, across the country. Who best to hear from in terms of how this was impacting young children than the people who likely love them most and care most about them, and that would be their parents and guardians. And so for this particular study, we did have a specific focus on Black children, parents of Black children, and you'll see here that there were 2 informal surveys that were meant to capture stories, and we ended up doing so from about 95 different families in 17 states, and you'll see the breakdown here. So one of the questions that we posed was, do recent incidents, and at the time, recent incidents might have included the, the death of George Floyd, do recent incidents make you feel more worried about your child's future? And they could answer yes, no, or unsure. And here we'll see that 89% of those who responded said yes, they were definitely more worried. 9% said no, and 2% were unsure. And so the first survey that was sent out, and we ended up combining them, had a response rate of 73% from New York State, and then the second survey was overwhelmingly South Carolina at 46%. And so there was a minor difference, regional difference in how these questions were answered, and I think the biggest difference is at the whether or not is around increased worry, those who said that they did not have increased worry. In other words, whatever level of worry they had before, these incidents and all of the media coverage and, just noting these incidents have been happening for a long time, but there was a heightened level of media coverage and a heightened level of civil unrest as a result. And so the difference here is that we see 7% in the survey one that was heavily New Yorkers said that they do not have a sense of increased worry, whereas a greater percentage, 12% in the South Carolina censored study said that they did not have an increased sense of worry. And some of the stories that we have heard here, one parent says, "I feel that she has been treated unfairly as far as discipline at her school. After an altercation with the white student, my child was punished more harshly when it was the other student who instigated the situation." And that comes from a guardian of a 14-year-old girl in Connecticut. The next slide, we see another story. In second grade, my boys experienced a situation where students made a list of the good kids and the bad kids. The bad kids were all of the Black boys, my twins, and the good kids were their white classmates. My child received an in-school suspension for writing a nonviolent note to his bully. However, the note delineating good guys and bad guys by color was met with, "Well, sometimes children make things up to get out of trouble." And so this is, I shared those particular stories because we are talking about implicit bias and what things may look like, what the experiences of children may look like in the classroom through the parents' eyes, through a guardian's eyes, what it is that their children are experiencing on an everyday basis, and how how it impacts them. The current story, the slide that we're on here with the twin boys is really interesting because it gives an example of, you know, how hurtful it can be when other children, when a child's peers may actually be the ones displaying the implicit bias, and you know, they're probably too young to even realize that what they're doing is hurtful. But it's important to note that environment is so important because children will pick up these things from their environment and from even society, so not necessarily at home. So another question here had to do with parents' emotion based on perception of their child's skin color or race. When thinking about how society may view your child's race and or skin color, what one word captures your emotion? So on the next slide here, you'll see you'll see a word cloud that basically summarizes what the responses were to that question. And when we have word clouds, the words that appear larger are the ones that appeared several times or most frequently. And so you'll see that the largest writing is for things like fear, angry, sad, unjust, terrified, misunderstood, inferior, concerned, sadness. Those are things that that appear. Enraged, inequality. So just pulling out a few of those responses and what explanations they had. So one respondent said that they feel terrified, and they said, in saying I'm terrified, I'm very scared. What can I do as a parent to make my kid feel safe, make my kids feel safe? Being respectable or engaging in respectability politics doesn't help. I want my kids to be their full and true selves, but I know that doing so could endanger them. And this is from, I believe it was a mother in Texas of 1-year-old twins, a boy and a girl. Uncertainty was another response to this particular question. Their race is polarizing in terms of how they're viewed, depending upon the person. I fear for their safety when they are away from family and major systems such as school, where they are primarily safe. What's interesting here is that school is this parent captures school as a place where the child is safe, and of course that's ideal. That's what we want. Classrooms should be places of safety for children. And so this one came from a parents or guardian in Florida of a 9-year-old, a 15-year-old, 17-year-old, and another 17-year-old. So likely twins. Okay, so moving along to what we can do, and you know, hopefully this might be the most helpful section, because you know, we can always point out things that have gone wrong. We can talk about the ill effects of implicit bias, but it's helpful to know what can we do to move forward, what can we do to, you know, to get past this. And so we'll talk a bit closer to the end about what, you know, what ICS as an organization with a mission of ensuring the success of all children continues to do, and anything new that we might have implemented. But we'll also be talking about what we learned from parents and guardians, and then also what we've seen in research around how to make classrooms more inclusive places for children. So we at ICS have a mission that is steeped in equity. When we talk about you know, envisioning a world where all children are successful, then of course we know that we need to focus on groups that might be marginalized, children that just don't have the same access or the experience, the quality of experience that they should be having in this role, especially when we're talking about newborn through age 8. Okay, so this nothing about us without us here is meant to highlight that at ICS, we see parents and guardians and community members and those who are experiencing the issues that we're talking about and the issues that we are attempting to address, those with lived experience. We see them as key stakeholders. Oftentimes it's been my experience that when we start to get into conversations about stakeholders, we're really talking about money and influencers and things of that nature, and we never want to be viewed as if we're in some ivory research tower, completely removed from what's actually going on within our communities with children and families. And so this is our way of saying that we know that those who are closest to the issues needs to be seen as key stakeholders and leading the charge on creating the solutions or providing guidance, and not saying that the onus of discrimination is on the community who's being discriminated against, but rather that we're willing to pass that mic and listen with humility when it's necessary, when it's needed, which is probably all of the time. And so here is what we heard from parents and guardians when we said, so what can be done by an organization like ICS or another organization, just in general, what would make you feel better about your child's prospects during this time? What would make you less concerned? What do you think needs to happen in order for them to really have a bright future? And so this is the exact question that we pose. Given the current and ongoing climate of racial injustice in the country, what advice would you give, or what would you want an organization committed to improving outcomes for children to know, so that the organization can, with empathy and understanding, effectively serve Black families and Black children? And so here are some of the responses that we received, and some of them kind of really hone in on things that we've heard before, that we already knew. And it's good to have reminders of in this work. It's good to have reminders, and it's good to have things come directly from those who are impacted by what we're speaking about. And so, combat adverse childhood experiences. So this is from a mother in Florida who has 12 and 15-year-old boys and a 17-year-old girl. And basically she says that her children are afraid, that she recommends organizations provide therapy for PTSD, depression, and anxiety, essentially noting that these are the things down in Florida that her children, who are almost all teenagers, were dealing with at that particular moment. Diversity and anti-racist training. And so, the quote here that you'll see here is basically saying that we all need to be more culturally sensitive, and that is something that should be built into schools and organizations that serve children or influence policy. And basically, and also saying that diversity training is for everyone. And I kind of added in the anti-racist, because if we're not talking about, equity and inclusion, and kind of tearing down those systems that systemically have been the causes for this level of implicit bias, then we can't really affect any kind of real change. Focus on policy. And this is, I believe, the same person that we heard from before with the 9-year-old twin boys. And so she says, I've had to have this talk with my 2 boys at age 7. I never expected that this would be on my list of things to do as a mom so soon in their development. An early childhood research and policy organization has got to get ahead of the conversation. A think tank influences policy. Without your organization's guidance on these things, we will never get policy that will shift the conversation. You are the experts sitting at the table. And so also a note on expertise, and I should have mentioned this before when on the Nothing About Us Without Us slide, but one of the major reasons that we felt this need to reach out to guardians and parents is because as an organization, we also acknowledge that while we have a level of expertise in certain kinds of research in early childhood, and we can quote these statistics and all of that, we know that there's also a very valuable level of expertise that comes from lived experience. That is an expertise, and it's something that, that we need to listen to. Do the work, minimize implicit bias. And so this comes from a mother in Texas of 1-year-old twin boys and girls we may have heard from earlier. And so she says, I am the chair of the Black Alumni Board at my alma mater, and I know that I cannot solve racism. I deal with racism, but I cannot solve it. White people, especially white teachers, need to not see Black children as a threat. In 3rd grade, my teacher asked me how I could dress so nicely if I have a single mom. Dressing nicely didn't make her think I was from a home where I was taken care of. Instead, it made her suspicious of my means. White people need to do the work. And so this is someone basically recounting their own experience and why they're fearful for their child because they've been through it, of saying, there's this basically, why would you ask a child a question like that? It's very strange. But feeling that they were a victim of this, and just that they were constantly seen as a threat. And when I read this now, especially given that several slides back we were talking about adultification of Black girls, it's like that's not a conversation that an adult should have with a child. Maybe not a conversation that you should have at all, but definitely not with a child, to say, well, why are you dressed like that? You have a single mother. It's very strange. So definitely speaking to her as if she is older than she was at that time. So next slide, please. Gets to the root of the issue. So this particular respondent said, I shouldn't have to provide advice. That's the problem. Why does anyone need to tell racist and bigoted people how not to be that way? And so, this is why I put in a disclaimer, having heard this and knowing this myself, this is why I put in a disclaimer a bit earlier that basically said that while we want to make sure that we are centering solutions in the community and listening to those who are most impacted by implicit bias, and those who are at home with these young children, we also don't want to necessarily put the onus of the resolution on them, because we know that there are systemic issues that are at play, and there is a need to get to the root of the problem. So it was really interesting to hear this directly stated. Silence is consent. Speak up. I would want an organization to know that parents are afraid, that we don't trust the very systems that have been oppressing us for years. Racism will not change until our white peers open their mouths and speak up. With racial injustice, silence equals consent. Organizations should also note that children begin to recognize their differentiated treatment as early as age 2 and 3. The silence is also noted by children. So essentially making sure that we are all speaking up, and that if you see something happen with someone, or if you even with a child in a classroom, perhaps and you weren't necessarily the person involved, maybe speak up. And I know that that can be an awkward position to be in, but frankly, shifting cultures is not going to be comfortable. Culture change, and getting to the root of implicit bias and kind of rooting it out. And so I was on a call recently with someone who said that that her son has a friend in a class who, the two boys are very good friends, one white boy and a Black boy, and they're always kind of just getting into things in the classroom and running around and playing and doing things that kids do. And she said, as a mom, she noticed that the child had either been taken out of the classroom or received some kind of punishment that her son didn't. And she brought it to the teacher's attention with also a stack of research. And the teacher actually went home, read everything, came back and said, thank you, because I didn't know that implicit bias was a thing. I didn't realize that there was this issue of punishing kids differently here. And I didn't know that restorative justice is something that I should be thinking about in a classroom with children that are this young. And so I really enjoyed hearing that story, simply because in my mind, that's a best case scenario, that you actually do provide information. You kind of, stick your nose into something and it results, and it's a good result, instead of a, how dare you kind of thing. But, this work is uncomfortable, but we are hearing from parents and guardians that we need to be more bold and speak up. And I think Beth Humphreys has commented, growth comes in the moments we are uncomfortable. Being uncomfortable is a positive step. To that I say amen. So thank you for that comment. All right. Admit it, we all see color. Not seeing color is part of the problem. We all see color, but the respect and dignity needs to be the same. I will tell you that this is something that is an overwhelming feeling within many communities of color. And it's probably a statement that either is meant to be very well-meaning or is meant to cover up whatever bias is happening. Like, I'm doing this, but it's not because of your race, right? So either way, whether it's well-intentioned or not well-intentioned, it's, for a lot of people, it's a microaggression. So that's something to throw out there. I think the thought is that, well, if I say that I don't see color and people believe it, then they won't think that I'm ever doing something that is, that is biased. But again, we all have biases. And I'll just give a little shout out here to Jessica Sharp of Sharp Brain Consulting. She gets into the nitty gritty of like basically like how we all have biases based on how our brain works. It's a scientific fact. All right, next. Use white privilege for good. So this was a very short comment, and it comes from a South Carolina parent or guardian of a 3-year-old boy. Use white privilege to educate, inform, and change systems. And so essentially, if you are sitting in a place of privilege, in a place where you might be more listened to than the next person, or where whatever comment you're going to make was just unexpected, but it'll still be listened to, use it to try to affect some kind of change within your own community. And so as an organization, we have been focused on strengthening ourselves internally. I've mentioned before about, wanting to listen with humility. We also have committed to being anti-racist. Last year, we went through a 21-day, what we refer to as Kickstart. Many of you probably know it as challenge, but we wanted to basically say, we know that this is not the end. If anything, it might be a kind of beginning or continuation, and it's not going to end when this quote unquote challenge ends. We're going to keep it up. And also we've done our own work around understanding implicit and unconscious bias as an organization, including our, including our board of directors. So externally, some of the things that we have committed to, educating and working to actively eliminate things like implicit bias. And we know that, preschool suspension and expulsion exists. We know about adultification of Black children. We know about these different things. We know that in order to really be aligned with our mission and to fulfill it, that we need to focus on populations that are faring a bit worse in society and that have these added stressors that we saw in the pyramid that might be generational. We know that we need to have those focus. And so also staying, staying informed and also contributing to the latest research, not only about Black children, but also the Latinx community and other communities of color, other marginalized communities, knowing how things impact girls in the classroom versus boys, knowing, of course, staying on the pulse of socioeconomic differences and how that results in children faring worse or better in society. So those are all things, it's a lot, but we're committed to keep on doing it. And then also sharing stories like the ones that you've heard today, and we have many more with key stakeholders who could possibly use it to lead to some kind of change. And so we know that there are things that simply fall outside of our wheelhouse. We are a research and applied policy organization. We're not a direct service organization. We're not on the ground. That's why we're so committed to listening to those people and organizations who are. We're not in the classroom. So, we don't do things like mentoring. So we know that for things that fall outside of our wheelhouse, that we can certainly amplify the work of those organizations and individuals that are doing that work. And so towards creating more inclusive classrooms. So there is there's precedent for suspension and expulsion legislation. And this is essentially legislation that says, within X state, basically, you can't remove a child from the classroom. Maybe it's grades like pre-K through grade 4 or something like that. It varies state to state. And several states have incorporated similar legislation. They all have their own nuances. Some of them say you can't do it, remove the child from the classroom at all. Others say you can only do it if there is a threat of violence, because children have been removed from the classroom for things that are for nonviolent offenses. And so, there's precedent. It's something that can certainly be looked into as in terms of just using policy to create that change. Sometimes things need to be legislated in order for them to actually happen. We know that educators are stressed out and need support. That you can have your own traumatic events that are happening just from being in the classroom with children all day, or being on a Zoom with children all day, frankly, during the times that we are living in currently. So we know that that educators do need more support. And I will put in a plug here for 2 briefs that we have, and I'm not sure that we necessarily have those links on hand, but we do have 2 briefs that talk about preschool suspension and expulsion that also get into other other potential solutions and recommendations. And so one of the briefs is South Carolina specific, and another one talks about preschool suspension and expulsion in broader terms. And actually, our senior fellow, Dr. D. Steglin, is the author on one of those briefs, and we really enjoy and have benefited from her work. So also looking to hold implicit bias trainings. You know, it should be something that we're all open to, because we all have our own biases. Being open to these trainings does not mean that we're saying, you know, oh my goodness, I am a bigot, I am a racist. It is saying I want to be my best self, and I want to make sure that there aren't biases that I may have that stand in the way of me fulfilling my organization's mission, or frankly my own personal goals and missions in this life. So that's really what it says, that you know, you want to be better, and you realize that there might be this thing that's in the way. Minimizing exclusionary discipline, and that goes back to the suspension and expulsion legislation as well. But just, you know, legislation doesn't have to happen for a teacher to say, I'm not going to do this in my classroom, or it's going to be an absolute last resort, or I'm just going to be aware of how I use it. And so maximizing restorative justice practices, you know, so trying to figure out what else can be done in this moment with the child, so that they don't have to be excluded from the environment where their peers are and where they're meant to learn. And I do want to note that ICS is partnering with Palmetto Shared Services Alliance and also Sharp Brain Consulting to offer more in-depth implicit bias trainings this spring that will be open. We're very excited about it. Okay, this is our final poll question. Do you see how implicit bias may affect your day-to-day work? And it's a yes/no question. There's no unsure in this one. Everyone said yes, so that's great. Next slide, please. So a closing reflection that I hope leads to a discussion, a little bit of time that we may have left here. What are you doing in your daily role to become more educated about and tackle implicit bias? And feel free to put those responses in the chat, and we'll kind of, you know, read them out as we see them happening. And it's okay if this is something that is a work in progress. I really don't think that any of us have it perfect. It's not an easy topic. What matters is that, you know, we're putting in the work, and we're doing what we need to do to move forward, to be more mission aligned. Okay, we see, I think it is an adverse childhood experience. It affects a child's emotional and social development, often giving them the feeling that they are less than. We have a response that says, reading and having tough conversations. Another person, being an active voter in my community and pushing for policies that push for equity in my area. Yeah, civil engagement is really important, civic engagement. Checking in with the parents and caregivers of my clients about their perspective and values during treatment. Definitely putting myself in positions like this, listening to learn. Taking time to learn about the family culture and language helps to engage with my patients in a more meaningful way. Definitely a work in progress for me. I try to read books on the history of implicit bias and try to have these tough conversations when I can with coworkers or friends, and conversations like this. Being intentional about peer groups in the classroom and pacing children together from different ethnic groups so they learn from each other organically. Another response, just being aware and having hard discussions with others when needed. Change is needed, but we have growth when we are uncomfortable. Personally distancing myself from those who truly won't change. These are good. If anyone else has anything else, please keep them coming in the chat. I look forward when we can all do this in person again, by the way, and kind of sit down and have this as a kind of roundtable conversation where we learn from one another in terms of, you know, what we're doing at our different organizations and agencies, and smart practices around moving forward.
Okay, folks, it looks like we've come to the end of our session. So Mary's given us a lot of information, a lot of great references, which are linked in the chat box if you haven't seen them yet. if you want to try and get one question, and we might have, we might can fit one question for Mary just at the very end. But aside from that, we'll give you a minute to leave a question if you've got one. I know this has been a lot of information, a lot of great information, and all of it will be included in an email at the end of the conference. And next week, you'll also be getting a recording of this session. So the email coming afterwards will have Mary's presentation, as well as all of these referenced studies and articles she's provided for us.
Thank you, Amber and Lisa, for holding down this session. Appreciate it.
Thank you, Mary. Thank you so much. And thanks to everybody else for being here and for all the great work you do. Have a great day and enjoy the other sessions coming during this conference.